Hi, everyone. It's Tim Ria here live in studio with a good friend of mine here at the Digital Health Summer Summit SF. We're with Jeff Makowka, who's a senior strategic advisor for AARP.
Yep, good to see you again, Tim.
And always good to see you guys have sponsored the show, brought us to CES last year. So we're going to kind of catch up. And but first of all, what do you do?
All right. So I work in a small group in AARP focused on stimulating innovation in the marketplace that benefits people over 50. So for the last 2 years, we've been focusing on the digital health and wellness area, mainly at consumer-oriented technologies that can really empower people to live their best lives. So we interact with entrepreneurs and investors trying to both demonstrate the market opportunities associated with serving people over 50, but also encourage better product design, better product offerings out into the marketplace. And we do this in alignment with our social mission because we feel like our mission, which is to improve the quality of life for all as we age, technology and especially health-related technology can play a really integral role into improving people's lives.
That's so cool because a lot of people think of AARP as something that you guys are doing a lot of innovation. On the panel today, what was the panel and what were some of the hot topics?
So the panel was focused on how better design can help bring better products to market, and how in some cases entrepreneurs and even people that are not even building design or products are misaligned. They're not really accurate about what they think about the 50-plus space or even the 65-plus space. So we discussed sort of what are the principles, how do you do some great techniques to make sure that your product or service is best optimized for the people you're trying to serve, how to build empathy for your potential customer so you can build a real product solution. And then we actually showcased a couple startups that have done some really interesting and creative, really and aesthetically pleasing things that are functional and really can help people live better lives.
Yeah, I sent my stepmom a new iPad out to Hawaii, and she lives at the edge of the road past the Buddhist temple. And then I kind of see her fumbling around the interface still, and you think Apple would dial it on, but they haven't.
Yeah. I mean, they certainly, in my experience, I think Apple does this kind of just as part of their design ethos. Just the part of the company. We like to call that an example of universal design, where my 20-month-old son and my 70-year-old mom can both use my iPad with relatively low friction. But what we're not seeing is other people doing that, and it's what's even worse is when someone goes towards the senior market, they do so with these stigmas in mind, and they build these little gray boxes with huge fonts and big buttons. I think as much as any other cohort, any other customer, people, whatever their age, want to be delighted by design. They want to feel empowered by the solution you're giving to them. They want to feel good about using it. And so while there's some good products out there, I think there's a lot of work that can still be done.
So the team that runs the Digital Health Summit also does Silver Summit, and those are kind of broken into different age group brackets and sections. What's new with the thought process of, we said lifelong design? Or what was
So Robin Raskin just today at the end of our panel announced that Jill will be producing, which we're very excited about because Jill does such a great job, a new conference around lifelong tech, which I think it's great because what people end up doing is they kind of pigeon themselves when they start trying to design for a specific age group, 50 to 64 or whatever that might be. I think what you need to do is really look at different conditions, different life stages, different lifestyles. And I think the term, just as silly as it might be, shifting the name of the conference from the Silver Summit to Lifelong Tech opens up this conversation so we can start talking about how are people living and how is technology enhancing or improving or changing their lives, rather than just are people with gray hair using boxes.
Once you hit 55, it's like all of a sudden your whole body flips. No, it doesn't work like that.
Exactly.
So you do a number of innovation events where you bring entrepreneurs together with investors, and then with all of your data on the RP market, what's cooking there and what's happening next?
So yeah, we're continuing to build a program that we call Health Innovation at 50 Plus, and it takes place within our AARP member event, which happens twice yearly. We just had one in Boston just a couple months ago in May, and we were very excited. We had 10 great innovative companies. They got on stage for 4 minutes. They pitched to a panel of top-tier VCs, and then we also give our AARP members audience response devices, and they respond to the pitches right there. Would I use this? Would I recommend it to a friend? Is this a true innovation? Yep, big screen with bar charts, and in some
no fear on that one.
Well, yeah, in some cases it's a little bit upsetting. You see the entrepreneur who's been putting their life's passion into this product for 3-4 years, whatever. And then, yeah, exactly, they look up and you can see the blood drain from their face when only 10% of people thought this was really worth something they would actually use. So we're continuing to build that program. We're really pleased with the folks that came and participated, not only the companies, but the audience and the investment community in Boston that came out to witness this. So we're finally at a point now, after 3 years, where I feel like we've got momentum. We're building an ecosystem around this topic. So it's very exciting times.
You guys have been doing those with Demo and a whole bunch of others where we connected up. So entrepreneurs out there want to connect up with AARP, other folks, what's the best route?
Sure. So probably one of the best ways is to find me on Twitter. I'm at @jmakowka, JMakowka. I'm sure you'll superimpose it. But also, we've got some web pages on AARP.org. Just look for AARP.org/innovation50PLUS. That's got our research there, how to get a hold of us, where we'll be appearing and speaking if you want to meet us in person, and announcements about our relationships with large organizations, accelerators, incubators, and funders.
So that's Jeff Makowka with AARP, longtime supporter of innovation and great resource, huge membership, and fun guy, good guy.
Thank you very much. Great to be here. Thank you.